In future, we'll want to see trials where that's reported more rather than just response, because we know it's meaningful to patients. And it may actually also help differentiate which drugs are useful from which are less useful. Yeah, so the really big next step is the second phase 3 trial. So we usually look for 2 positive phase 3 trials for a lupus drug, and one's been done. The second one is in progress now, which has a very similar design. So that's the most important thing. But there are some other things being investigated. For example, patient-reported outcome measures are being explored with Dapi. Again, those can be quite difficult to demonstrate in lupus trials. We think these drugs don't just improve physician assessments, but also make people feel better. But that can be quite hard to show in trials. But some of the early analysis of these trials, not all of it published yet, does seem to report quite good outcomes in things like patients' report of how their fatigue improved. So there'll be lots to sort of chew over with the data from these trials over the next few years. I mean, in the world of lupus, we've spent a long time with only one biologic. Then now we have 2 biologics, one other sort of novel therapy, but there are lots of phase 3 trials in progress. And in the next 2 to 3 years, we could be in a situation where there are a lot of drugs to choose from, which will in some ways make things a little bit more complicated, because rheumatologists are now going to have to ask and all these drugs work in different ways, by the way. So rheumatologists are going to have to sort of think, well, do I want to target B cells, or do I want to target interferon, or do I want to target CD40, or do I want to target TLR7, and so on. And so there's going to, I predict there'll be sort of intense interest in trying to work out which mechanism is right for which patient, which is difficult, but it's a good problem to have. Yeah, I mean, that's of course the other aspect. When you have more tools at your disposal, you also think not just about like, I'm going to choose one of these drugs, which ones it's going to be. It's also about how you deploy them. Should they be coming earlier in the disease? Should the use of steroids be less? Are other drugs that we already use for lupus being combined with these, or are they being replaced by them? How long do you keep treatment going? Can you stop it at certain times? All of these questions. How do we manage issues around pregnancy and childbirth? One of the big problem for managing people with lupus. How do we manage people who have other conditions like chronic infections or cancers and so on? So there's a whole range of questions that come into play when you have more tools at your disposal.